Ambulatory surgery, widely known as outpatient surgery, is on the rise in Singapore, projected to grow 11% annually through 2029. To explore how this trend impacts specialized disciplines, we have Dr. Gerald Tan from the Advanced Urology Associates, Dr. Val Fua from Eagle Eye Center, and Dr. Reginald Liu of the Harley Street Heart and Vascular Center. Now, starting with Dr. Tan, what has changed in your specialty regarding outpatient care?
We are urology specialists that deal with diseases of the urinary system. So we deal with problems of the kidneys, the bladder, and the prostate. The most significant changes that we have seen in our field of work has been, number one, the development of evidence-based, internationally accepted best practice guidelines for almost all diseases affecting the kidneys, the bladder, the prostate. So in short, in layman's terms, there's nowadays almost a factory line protocol for managing most common conditions. And secondly, we've also experienced huge advances in surgical techniques and technologies that now allow patients earlier recovery and shorter hospital stays.
While ophthalmology has evolved significantly over the years, there is advances in diagnostic capabilities, allowing us to pick up diseases early and hence allowing for earlier intervention. For example, the oculizer allows us to image the cornea quite detailedly, allowing us to pick up cases of keratoconus and also identify suitability for refractive surgery. I think advances in surgical techniques and capabilities have also made a difference. For example, in cataracts, the standard of care now is phacoemulsification, which is the use of ultrasound energy to remove the cataract through a small self-sealing wound, and resulting in the surgery being safer with faster recovery times. And of course, another point would be digitalization. This has allowed increase in clinic efficiency with the use of electronic medical records and platforms that streamline the workflow, and this enhances patients' experience with reduced wait times during clinic visits.
We're starting to develop centers that can pick up diseases earlier to provide better diagnostics such as CT, coronary angiograms to detect coronary artery disease, echocardiograms to look at heart muscle function with an ultrasound, special cardiac stress tests. And also we are starting to provide some treatments as well. For example, some patients with chronic heart failure need to have frequent treatments to drain off fluid from the heart using intravenous diuretics can be done in an ambulatory cardiac center rather than traditionally being admitted to hospital.
Are there any interesting trends that you've observed in patient demand for outpatient services, particularly in your field?
Well, I'll start with the kids. Singapore is often called the myopia capital of the world. 65% of Singaporean children are myopic by the end of primary 6, and it's projected that by 2050, 80 to 90% of all Singaporean adults will be myopic. So the issues with myopia go beyond wearing glasses. There are sight-threatening complications such as macular degeneration, tears, and retinal detachments. So of course, there's an increased demand for effective myopia control, and this often comes in the form of atropine eye drops. For young adults, myopia is on the rise, so there's increasing group of patients who are dependent on glasses and contact lenses in the long term. And hence, there's a demand also for refractive surgery, as a lot of patients want to be glasses-free as well as contact lens-free as well. In older adults with increasing life expectancy and a global aging demographic, we find that there's increased demand for monitoring and treatment of age-related and chronic conditions such as cataract, age-related macular degeneration, diabetic retinopathy, and even glaucoma.
Well, as patients are being diagnosed more and more with heart disease or have symptoms suggestive of heart disease, they also want to have quicker access to cardiology services, both for diagnostics and also for treatment. And as a result, patients also want the convenience of seeing their specialists earlier and in a setting that's more convenient for them to go to. So, for example, patients would rather go to a cardiac center, ambulatory center nearby, where they can have access to the specialist without having to go to a busy tertiary center hospital where there's often longer waiting lists, or they may have to queue up to enter the car park. And also the specialists would like to see patients more easily as well by having the test done on the same day, seeing the results, seeing the patients, and come up with a plan of action earlier.
Many countries in our region are experiencing a rapidly aging population. So many of these fit elderly patients, they're experiencing prolonged inpatient hospital stays for conditions such as falls with fractures, strokes, pneumonias, etc. As a result, many times our public and private hospitals have a shortage of beds, resulting in long waiting times for elective surgeries. And lastly, there's also growing awareness among both the young as well as the elder patients in terms of health screening. So now that more and more people are going for health screening, many conditions are being diagnosed at an early curable stage. So most of these conditions and in early stages, they just need a day surgery admission for either completing tests such as CT scans and scopes or minor procedures to scrape out early tumors.
So given these trends and observations, how do you see outpatient care evolving in the next 5 years?
I think for ophthalmology, outpatient care will continue to be the cornerstone in providing effective eye care. There will be a shift towards a more integrated, patient-centric, and technology-driven model that prioritizes efficiency as well as convenience, making this high-quality eye care accessible and effective. Patient-centric digitization efforts include online registration and appointment scheduling, use of electronic medical records to streamline the workflow, digital consent forms, and also platforms which allow real-time dashboard of patient numbers, location, and even waiting times, allowing us to have better crowd control during clinic visits. I think there will be an increased utility of artificial intelligence in diagnostic workflow, particularly in diabetic retinopathy, age-related macular degeneration, and glaucoma. I think the use of telemedicine will also continue to be increasingly adopted. It has use in following up patients who are quite stable and reviewing patients who are overseas for even a second opinion. I think the trend of minimally invasive procedures will continue. It has resulted in faster, safer and surgeries with quicker recovery times. And together with this, with the streamlining of workflow and connecting devices, allowing an integration from the clinic to our operating theater and even back as well.
As technology improves, more and more of what we do as cardiologists and heart specialists can be done in an ambulatory care setting. So with improving technology and easier access, I think there will be a large growth in ambulatory care that will translate, I'm hoping, to better care for the patients, faster diagnosis and earlier treatment, ultimately to improve patient care and long-term outcome.
Many common conditions are now well managed using internationally accredited best practice protocols. So for many of our common conditions, such as patients who come for a checkup for blood in the urine or for pain involving the urinary system, we will get them to come to a day surgery setting where we can expedite blood tests, CT scans, and scopes of their bladders under sedation on the same day. And when they check out, by the end of the day, they'll have all their results available. For kidney and urinary stones, we nowadays use high-powered lasers as well as very miniature scopes that allow us to do these surgeries bloodlessly through either tiny or no incisions at all. For enlarged prostates causing urinary blockage, we also have numerous new technologies that allow us to either open up the prostatic channel using implants or to reduce the bulky size of the prostate using high-power new lasers to scrape out or enucleate the tissue. And I think we're going to see a lot more such surgeries becoming mainstream and patients having their surgeries done in a day surgery center rather than in a traditional hospital.
Thank you so much for joining us today, everyone.
You're welcome.
Thank you for having me.
Thank you very much.
Once again, those were Dr. Gerald Tan, consultant urologist and CEO at Advanced Urology Associates, Dr. Val Fua, consultant ophthalmologist, cataract and refractive surgery specialist at Eagle Eye Center, and Dr. Reginald Liu, senior consultant cardiologist and director of the Harley Street Heart and Vascular Center. For more news, visit healthcareasiamagazine.com.